Okay, let's talk about bladder treatments. This is where we put medication directly into the bladder where you need it the most. How do we do that? With a catheter. Now you need to be very, very careful with your bladder installations. Don't let anybody put anything in your bladder without telling you what it is and what it is supposed to accomplish. Why do I say that? Because in the old days, they used to use very caustic, painful treatments, one's called Chlorpactin, the other's called silver nitrate, that are no longer even mentioned in the AUA guidelines as IC treatments. They caused a tremendous amount of pain. So today, what we're trying to accomplish instead is a bit of a coating and soothing effect. And the first way that they can do that is with heparinoid therapy. That's generally heparin, chondroitin, or Elmiron. Now, Elmiron is associated with some pretty significant adverse events when taken by mouth. We're not aware of those events also occurring when you put it into the bladder, but you're going to have to talk to your doctor about the pros and cons of using Elmiron in any bladder installation. Now, the most popular installation around the world is a rescue installation. Why do we call it a rescue? Because it will rescue you out of a flare. It usually combines heparin with lidocaine or marcaine to numb the nerves in the bladder wall. So why do we call it a rescue? Because generally you will walk out of the doctor's office for a few hours without pain, and believe me, that's a wonderful feeling if you've been in a severe bladder flare for a long period of time. There are a lot of different formulas with rescue installations because doctors like to customize and create their own. I've assembled all of those formulas over on the IC Network website. You're welcome to print that out and bring them to your doctor so that you can discuss how he or she is proposing to treat you. Generally, the protocol for a rescue installation might be once a week for several weeks, or it might be a couple of times a week for a few weeks and then going to once a week. Now, the third type of bladder installation has definitely fallen out of favor in recent years. It's called DMSO or RIMSO 50. This is a byproduct of the paper industry, and they're still not quite sure what it's doing in the bladder, although it does act to penetrate deeply into the bladder wall. So sometimes you see installations that combine everything. They'll have the DMSO, they'll have the heparin, and they'll have the lidocaine. Now, there are a couple of things that you need to know about bladder installations. Number one, if you're doing them at home, never, ever, ever play with the formula. Never increase any ingredient, especially sodium bicarbonate, which will enhance absorption. You have to always stick with the published formula that the doctor is giving to you. Number two, when it comes to catheters, using what we call a low friction catheter is the easiest because it's slippery on the outside. So it's easy to slide in your urethra and it's easy to pull out. Sometimes catheter size matters. I see patients tend to do a little bit better with smaller in diameter catheters, often pediatric catheters. So if you find the catheters are too big, you can always ask for a smaller pediatric catheter. And then last but not least, there's a lot of debate about what we call dwell time. How long should that installation be held in your bladder? There is a belief that the more you held it, the better, but that's certainly kind of fallen out of favor. Research studies don't necessarily support that. The general dwell time is 15 to 30 minutes. Do not do what I did and try to drive home with DMSO in your bladder. Huge mistake, incredibly painful. Always stay at the doctor's office, just hang tight in the waiting room, hold it for however long your doctor asks you to hold it, then urinate, then drive home, all right? If you have any other questions about bladder installations, come on over to the IC Network website. One last point, because I've been there. Number one, anytime you insert a catheter or any instrument into your urethra, it can stretch the urethra and cause irritation. The first few times you urinate afterwards, your urethra can be quite sensitive and or painful. This usually resolves within a day or two, but it can be helpful to spray your urethra with water, either warm or cool, as you urinate. Peri bottles are available at the IC Network shop. It can be helpful to soak in a bathtub with warm water, but please no scented bubble bath or bath salts. To calm and soothe those tissues, maybe use a little baking soda or a vino. If your symptoms worsen, you develop a fever or severe pain, please contact your doctor to let them know. They may need to screen you for a UTI. So take-home summary. Number 1, bladder installations involve placing a medication directly into the bladder with a catheter. Number 2, never allow anyone to place the medication in your bladder without first telling you what it is and how it will help you. Number 3, silver nitrate and chlorpactin are no longer suggested for IC. Number 4, the most popular treatment today is a rescue installation because it can reduce pain for a few hours or days. Number 5, do not change the formula if you're doing home installations. Number 6, low friction catheters make treatments much easier. Number 7, confirm the dwell time of your treatment with your physician. And number 8, we strongly suggest that you not try to drive home with an installation in your bladder. If you're looking for any additional information, come on over to the IC Network, icnetwork.org.